Do you currently smoke?
Yes.
This is a critical question to ask. It is essential that all tobacco users are identified at every office visit.
How many cigarettes do you smoke per day?
Probably a pack a day.
This is an appropriate follow-up question. The patient will need to be asked several questions regarding his or her smoking habits in order to be properly advised to quit.
So how long have you been smoking?
About 10 years.
When you feel ready to quit, please let me know and I will try to help you.
By not encouraging the patient to consider a quit attempt right away, this advice is not strong enough. It also ends the conversation, implying that the remaining steps in the 5 A's tobacco counseling model will not be addressed.
It is important that you quit smoking and I can help you.
Correct. When advising the patient to quit, it is important that the advice be clear, strong, personalized, and non-judgmental. This response makes clear that the patient needs to quit smoking.
I usually cut down when I get sick.
I don't think you understand the severity of the health risks if you continue to smoke.
Although this advice is strong, it is also judgmental and not personalized to the patient's situation. It is recommended that advice to quit be tied to negative health consequences, economic cost, and/or impact on other individuals living in the household.
I'm glad that you're able to cut down, but there still are long-term consequences if you continue to smoke. Quitting smoking is the most important thing you can do to protect your health now and in the future.
Correct. Motivating the patient to quit starts with praising his or her ability to cut down and emphasizes that cutting down does not replace quitting completely.
But quitting isn't easy. I've tried before and it didn't work.
Most people do have to make several attempts at quitting